Good afternoon, everyone. Today is Tuesday, July 21st. I'm Rendy Murphy, epidemiologist at the Mobile County Health Department, here to provide a few tidbits of information and answer your question about the effect of the COVID-19 pandemic on Mobile County residents. So this morning we reported on 6,340 Mobile residents with COVID-19. 129 were added just yesterday. Still holding at 167 who have died. We did not get a new notification about a death since yesterday. We know from talking to our hospitals and looking at our data in the Alabama Incident Management System that our hospitals are faring okay. There is bed availability. I want to just point out one thing that was reported incorrectly in the public media yesterday. We reported on the number of COVID patients that have been hospitalized in Mobile County as of July 17th as 1,005, and noted that that number includes the cumulative total admissions and discharges, which were 840, plus the number of admitted patients with confirmed COVID on July 17th, which is 165. So that 840 number is the cumulative number of COVID-19 patients that have been hospitalized since back in February, not last week. So my apologies if I misrepresented those numbers, but I believe they were misunderstood. And again, we do not have more COVID patients, 1,000 COVID patients in hospitals in 1 week. That 840 was a cumulative number since we began keeping records on COVID-19 hospitalizations in Ames. And on any given day right now, we're averaging about 150 to 175 patients in the hospital with COVID-19. So that is far below our capacity. And we spoke with the hospitals a little bit earlier today, and none of them have activated their surge plans in response to a bed shortage. So good news right now that our hospitals are faring well with, well, not well, I wouldn't say well. There are still staffing shortages as staff members who contract COVID have to go home while they ride out their isolation periods, or the 10-day isolation period, or those who are exposed have to go home for 14 days. So I want to restate what I mentioned yesterday about some of the changes in CDC, that the test-based method for discontinuation of isolation precautions or discontinuation of quarantine is no longer recommended by the Centers for Disease Control, and the Alabama Department of Public Health and the Mobile County Department of Public Health support that recommendation. So we are not recommending the two-test negative test-based strategy for discontinuation of isolation or quarantine any longer, due to a lot of reasons. One is we're putting an incredible burden on the testing supply, and we're seeing that test results are starting to slow down to, sometimes test results not coming back for a week to 10 days, and this makes decisions incredibly difficult when we are trying to work to identify and contain COVID transmission in congregate settings. That's one thing. Another thing is that people who test positive often are persistently positive. So now CDC is recommending that if you were symptomatic and had a laboratory positive COVID test, you should not test for 3 months. So again, your test could be inappropriately positive past the 10-day windows, right? So the live virus that you're shedding, by 10 days, you're no longer shedding live virus, but you could be tested positive by PCR just from the dead viral particles that are in your respiratory symptom. And that persistent positive could last for many weeks or months. So again, the new recommendation that if you are COVID positive and you're symptomatic, once you have been isolated for 10 days and asymptomatic for at least 24 hours, you can discontinue isolation and do not test again for at least 3 months. For people who have been exposed, again, we're using time-based method for discontinuation of quarantine. If you have been exposed to a COVID positive case, then you need to be at home for 14 days. All right, some media questions. Let me read a couple of things that came from the State Environmental Health Director of the Bureau of Environmental Services. These questions are primarily around permitted establishments, but I think that they're helpful to lots of people, and since the answer is already written, I don't have to come up with one. So number one, does the new Safer at Home order require all restaurant workers, including cooks in the kitchen, to wear masks? So again, this is referring to Scott Harris and Governor Ivey's order that everyone in public places should wear a cloth face covering that's over the age of 6. So here is the answer. Since there is a specific provision addressing employees of restaurants in the order, paragraph 19E, it controls over the more general paragraph number 2. Therefore, the issue requires that those employees in regular interaction with patrons or guests to wear a facial covering. Also, the kitchen area is not considered to be open to the general public. So again, even the amended order does not require kitchen staff or cooks to wear masks. Only those in regular interactions with patrons or guests to wear. Can a face shield be used as a face covering instead of a mask? The use of a face shield complies, so the answer is yes, as long as it fully covers the nostrils and mouth. So again, it must extend past the chin in order to fully cover the mouth. So if you have the face covering on, it can't be worn underneath the nose, needs to be worn over the nose and under the chin so that it covers your entire mouth. All right. Does the Safer at Home order, paragraph 19, require the health department to enforce convenience store checkout clerks wearing masks because they're interacting with the patrons? And it says if there is one person in the store that's serving food and that person is also a cashier for the whole store, then yes, that person should wear a mask. If there's a separate food service area, then that employee should wear a mask and the cashier doesn't necessarily have to. So again, just some Q&A on some of the frequently asked questions that we hear about the wearing of face coverings in places that serve food. All right, someone from the media asking if I can talk more about the why behind the changes in CDC, and I can. There is a decision memo that references a lot of literature and actually displays some data charts behind that are the reasons behind the Centers for Disease Control making these changes. One is, I think, as I've mentioned, that after 10, long before 10 days, people are no longer shedding virus. So that is the reason for it being 10 days and changing it from 3 days symptom-free to 1 day symptom-free. I think the extraordinary number, the greatest majority of people are no longer shedding at something like, 6.2 days or something like that, but that's driven by data. Then the issue about not getting tested for 3 months is really driven by 2 things. One is evidence of persistent shedding, or persistent PCR positive, when the particles cannot be grown live. So the particles that are detected are there, but they can't replicate, which means that a person who has this persistent shedding for weeks and months after a COVID positive are no longer a threat to transmitting that disease to others. Also, following a symptomatic infection, the Centers for Disease Control is learning more about immunity, and the thinking is that people who were symptomatic and positive, once they have gone through their 10 days isolation and are no longer symptomatic, that they will have some measure of protection from a secondary infection. So it looks like right now that while reinfection is biologically plausible, that there's not much evidence for that. So again, we don't think that someone who tests positive and recovers is going to be a threat to others or a threat to themselves for at least 3 months. Okay. some other, maybe these are easier questions. Second day of 0 deaths, do I think a surge in deaths might still be coming? What we're hearing is that it looks like either the number of deaths, we haven't seen it yet, or that it's remaining relatively low. We know that the use of remdesivir has been helping to reduce the number of deaths in the COVID patients that are experiencing the most dramatic and most severe complications, being in an ICU, being on a ventilator, those sorts of things. So we really hope that that treatment and also recognition in the hospital community about how to better treat these patients are contributing to a real sustained low number of deaths in our community, which would be great news. Let's see. What's the average lag time between when a COVID test is given and a positive report is posted? That's a good question, and we had gotten down to around 24 to 48 hours, and in the last week or two I fear that it has gone up. So I will be looking at that a little bit more closely this weekend, and I suspect that the lag between the test performed and reported has increased greatly, at least around 5 to 7 days, which for many weeks and months it was down around 24 hours to 48 hours. If I don't have COVID-19, why do I have to wear a mask if the mask protects others and not the person wearing it? The reason is because you may be shedding virus and not be sick and not have had a positive test yet. So that's the reason that we want to protect others from your germs, because we know that people don't know that they're sick, don't know they have COVID, and are transmitting virus to other people. If I'm closely exposed to someone who tests positive, what's the protocol? I have no symptoms, but they tested positive, and I was in 6 feet for longer than 15 minutes last week. So this is tricky. People start throwing these dates around. So if you were around someone today who got their positive test result today, then you must go home for 14 days, right? You were exposed to the person, on the day that they were PCR positive. So they were shedding virus because the PCR picks up the virus. That means that you're exposed and you need to go home for 14 days. If you were around them 4 days ago and they called you today to say they got a test and it's been 4 days since you were around them, then you're not considered exposed and you don't have to go home for 14 days. So it depends on the timing. For people who have symptoms, it's 2 days prior to symptom onset. But if you don't have symptoms, the exposure starts the day that you got your positive test result. So the day you were tested. Okay. Someone asking about their children who are attending school that's reopening, and they're concerned about the current trajectory and increase in cases. In order for a school to reopen, shouldn't the number of cases be decreasing? Maybe only reopen when infection rates are hovering around 5%. Yes, there are lots of different injects into this decision for schools to reopen. It is true that we are experiencing our highest rates of infection of transmission right now, and we have seen plenty of COVID in school-aged children. But these are not easy decisions, and I certainly don't envy the situation of a school superintendent having to make this based on COVID transmission in the community, the needs of parents to return to work, the needs of children to get meals, the needs of children to learn and socialize. So all of these things go into these decisions, and we don't tell schools when to open or close, but we rather advise and educate and try to inform them. And it will be interesting to see. A month or two ago, when several child care or daycare facilities decided to reopen, it was really interesting because they would reopen and be okay for 2-3 weeks, and then they would have COVID in their facility and they would have to close or send some students home for 14 days, and then they would reopen it. And this is what I expect will start happening when schools reopen, that if they are reopening for on-site instruction, that you should have a plan for your children and your family to have to stay at home for 2 weeks if or when you're exposed. I think at this point, everyone should expect that they will have COVID or be exposed to COVID in the community at some time over the next months, or maybe even into next year. And so you need to have a plan, just like you plan for hurricane or disaster, natural disaster. You need to have a plan for yourself and your family and your children should you have to quarantine at home because of exposure at your workplace or at the school, or if you become infected with COVID. Let's see, and there are some metrics out there. Everybody has a metrics for when is it safe to reopen schools. Yes, right now we're in a high or a very high risk, and making the decision to open a school right now is a tricky one. All right, if you test positive in quarantine, you get tested 3 months later, and that will show a positive test for antibodies. Okay, this is mixing everything up, right? So a PCR test determines if you have active COVID infection, the PCR test. That's the one that we don't want you to get for another 3 months. And we're also not recommending the use of antibody tests for diagnosing illness. So if in 3 months you get another test and it's the antibody test, it'll probably be positive, but that does not mean that you have infection. You have to isolate yourself every time you have a positive test. So if you tested positive last week and you're feeling better now, and you feel like you need to go out and get another test, which I'm advising that you don't do that for 3 months. If you get a second positive test, you got to go back home for 10 days. So you can get yourself in this cycle of continually having to go home when you really should not be getting a test anyway. But the last piece of this question, which is it counted as a new case? And the answer to that is no. If you test positive once, we count you the first time, and every time you test positive after that, we add you back to that one record. If you get tested positive 5 or 6 times, that does not count as 6 cases. You count as one case who's tested positive 5 or 6 times. So I will stop there unless there's anything on Facebook, and we will talk to you again later in the week. Thanks.